Hello and welcome to my channel. This is Isaac, Simple and Real. Today we're going to discuss more about cervical cancer awareness, and we'll be able to talk more deeply about what is cervical cancer, what causes cervical cancer, predisposing factors, treatment, and even prevention of cervical cancer. Welcome and walk with me through to the end of this lesson of today. Thank you. My name is Isaac, Simple and Real. Welcome to my channel. Kindly remember to like, subscribe, share, let more people be able to learn more about this channel so that they can be able to even educate others on the prevention and even care of persons who are suffering from cervical cancer. Thank you. I'll give you about 2 seconds so that you can subscribe to my channel so that we can be able to work together as we build this channel so as to be able to educate more people on cervical cancer and how people can live free of cervical cancer, and also how people can be able to stay well and stay safe and be able to avoid this cervical cancer. Thank you. To begin with, let us start by defining what is cervical cancer, or generally what is cervical cancer. This is a form of malignant carcinoma that usually appears in females on their cervix. It's usually a malignant carcinoma, and it usually manifests itself on the cervix. There are several predisposing factors, but there is a main microorganism that we usually blame for cervical cancer. And this microorganism, we call it human papilloma virus. This is the major cause or the main cause, microorganism that mainly causes cervical cancer. But apart from this microorganism, there are other predisposing factors that cause cervical cancer. To begin with, we say that smoking, cigarettes or tobacco, in short, contains so many chemicals, several number of chemicals, some of which can lead to cell changes, and these kind of cell changes can lead to cervical cancer. The others, we can say there are maybe someone who has a family history of cervical cancer, and then that person engages in a risk, maybe having several sexual partners who will transmit human papilloma virus to your cervix. You may end up getting cervical cancer. Now, what are the signs or symptoms, or how does someone who is suffering from cervical cancer present? There are several ways in which someone suffering from cervical cancer may present. To begin with, someone may experience pain while having sex. The other one is that is person who previously didn't experience any pain while having coitus. At this time, or maybe while having sex, at this time, this person will start experiencing pain. The other thing, we call it postcoital bleeding. This is bleeding after you have already had sex, or during the act of sex, or sexual intercourse, you start bleeding. And this is a person who has not been bleeding previously, and now this person starts bleeding. The other presentation, this person may experience, and this appears with time, is usually lower abdominal pain. As the cancer progresses, you may experience lower abdominal pain and usually lower back pain. These are some of the presentation that a person may present with, especially while having cervical cancer. It is also wise to know that, or to note that, these symptoms are not pathognomonic of cervical cancer. They do not define a diagnosis of cervical cancer. So, you may present with any of these symptoms, yet you're not suffering from cervical cancer. But a combination of all of them may suggest an impression of cervical cancer to be investigated for. Are we together up to that point? Thank you. Now, the other thing that I'd like us to discuss is how do we make a diagnosis of cervical cancer? There are several ways on how to make a diagnosis, and a healthcare worker is well best trained on how to define a diagnosis of cervical cancer. One of them, we decide to do pap smear. This is where we swab your cervix, we take some cells for histological analysis, and then upon analyzing your cells or cervical cells, we will be able to discover whether you are having cancerous cells or abnormally differentiated cells, which are suggestive for cervical cancer. The other thing that we may do, we may just examine your cervix visually by using a gadget that we call speculum. Usually, we put it inside your vagina so that we can be able to clearly visualize your cervix. And usually, a cervix that is having cervical cancer will appear in a cauliflower appearance. And usually, it easily bleeds on slight touch. The other presentation or the other form of diagnosis that we may decide to use, we can decide to do imaging. And imaging, this we say, it could be CT scan, it could be ultrasound, it could be, basically those are the main diagnostic modes that we usually use. Now, when we have confirmed that you have cervical cancer, the other thing that we do is we do the staging of your cancer. For stage 1 to stage 2A, this one is treatable. Why is it treatable? It has not progressed so far, and it can be treated surgically by removing the part of the structure or of the cervix that has already changed or has already become cancerous, or has changed, the cells that has already changed to be cancerous. So this one can be managed surgically, and this is the main reason why in our matters of prevention, we shall be discussing on the reason why we do annual screening or biannual screening for cervical cancer. Stage 3 and stage 4, these stages, the cancer has already progressed a bit further, and at this point, we usually are left with palliative management. Palliative is whereby we take care of a person so that they can live a more comfortable life while still having the cancer. You get it? So at this point, we do not have a curative modality that we can apply to this kind of a patient so that this patient will have a permanent curage. Now, let's go to how do we go to the prevention, because we usually say that prevention is better than cure. Now, in matter prevention, let's start with the vaccination or immunization. I know you have heard severally the government talking about human papilloma virus vaccine or HPV vaccine that we are usually offering to our adolescents. Ladies and gentlemen, remember this vaccine is being offered by the government of Kenya free of charge so as to be able to prevent the youths or young girls from them suffering from human papilloma virus, which can predispose them to cervical cancer. Remember, human papilloma virus is transmitted sexually, and usually at this age of below 10 or below 15 years, this is where they have not initiated, we call it koitake or sexual debut. They have not initiated, they have not become actively sexually active. And this is the best time because when you vaccinate your daughter at this age, they are less likely to suffer from a human papilloma virus, which is not which is asymptomatic and which can lead to cervical cancer. So at this time, it's the best time that your daughter to be vaccinated. Remember, this vaccine is only available for girls, not for boys, because girls are the ones who suffer from cervical cancer. Remember, boys may be able to host human papilloma virus, but since it is asymptomatic, they may not experience any much effects. But when it comes to girls, maybe when a girl is having several sexual partners, the likelihood of getting this kind of virus usually is double or more than double folds. So this girl is at a greater risk of getting cervical cancer. So when we can be able to prevent our daughters, our girls, by offering them this vaccine that is offered by the government in all public health facilities for free, we can be able to avert the spread or the new incidences of cervical cancers in the coming generation. The other thing, this issue of cervical cancer screening. I know we have all heard about cervical cancer, if not by our relatives, by our friends, by our neighbors, or by our distant friends. And about cervical cancer, usually it targets or usually comes while especially for women on their menopausal ages. When they are starting their menopause, most cases, this is when cervical cancer sets in. And this is very serious, that especially for all women of reproductive age, that is between 25 years and 45 to or 40, 45 years, 25 to 45 years, you should be able to get screened of cervical cancer by via villi. Usually, currently we are doing via or villi. Via is examination via acetic acid, and villi is examination under glucose iodine. These are screening methods that are usually applied at our health facilities, especially government or private health facilities, to be able to check for cervical cancer, especially to women between 25 and 45 years. These screening methods are usually free or slightly at a very slight charges, very low charges, to be able to accommodate every woman so that they can be able to be screened for cervical cancer. Remember, as I said earlier, when you are diagnosed between stage 0 to stage 2A, it can be cured either surgically or via cryotherapy. Or not, actually, currently we are also having the thermal ablation technique to treat cervical cancer, especially the stage 0. This is very effective and has helped so many women. Now, the other thing that we usually do, especially for women who are above 45 years, that is menopausal and postmenopausal, these women are usually screened for cervical cancer, usually by pap smear method. This, I said, is a cytology technique that usually the healthcare workers who are experts in this diagnostic technique usually examine this. They collect the cells from your cervix, and then they examine them using fine machines, and then they will be able to distinguish whether these cells have changed to be cancerous or not. So this is very important for menopausal and postmenopausal women. The other thing that is very important, and I think I must announce it and say it right now, is about persons living with HIV virus, especially women of reproductive age and after and postmenopausal women who are living with HIV virus. The risk of getting cervical cancer is usually more double-fold compared to those who are HIV negative. And for this reason, it is always very important and very necessary for these women who are living with HIV to be screened of cervical cancer on an annual basis. Usually this service for persons living with HIV is free of charge and is usually offered on our comprehensive care clinics. It is very important for you to be able to be screened for cervical cancer so that if it's detected, it's very easy to be treated on spot before it progresses to stages that we cannot be able to cure it. Remember, prevention is better than cure. And the other thing that we usually say in this channel, being positive about HIV is not necessarily being HIV positive. So, when you empower yourself, you empower others to be screened of cervical cancer. And for those who don't know their HIV status, to be screened, and if they are positive, to be initiated early. If they are on an ongoing risk, to be initiated preventive care on time, you'll be helping our society to live in a more healthy environment. Thank you for watching my channel, and kindly do not forget to like, subscribe and share. Let more people be able to learn about this channel so that we can be able to empower our community and our society to live in a more healthy environment. Thank you and God bless you. Do not forget to like, subscribe and share. This is Mkurugenzi Maish. Thank you.